Hello, everyone. I'm Nicholas Waters, pronouns he, him. I'm the Executive Director of the Knowledge Institute for Child and Youth Mental Health and Addictions. I want to thank everyone for joining the webinar today. It's exciting to see such a strong interest and participation in today's webinar. Your presence reflects a shared dedication to improving care and outcomes for children, youth, and families across Ontario. I'd like to get us started with a land acknowledgement. As we gather here virtually today, I want to take a moment to acknowledge that the land on which the webinar is being hosted is Ottawa, the traditional unceded territory of the Algonquin and Anishinaabe people nation. For countless generations, the Algonquin people have lived, worked, and cared for this land. We are grateful to share in this space, and we honor their enduring presence and stewardship. I know that we have participants from across Ontario and beyond, so you can share the territory where you reside in the chat. It is also important to recognize that tomorrow marks the National Day for Truth and Reconciliation, a time for reflection, remembrance, and learning. It is a day to honor survivors of residential schools, their families and communities, and to remember and honor the children who never returned home. It is also a moment to recognize the ongoing impacts of colonial systems and to commit ourselves individually and collectively to the work of truth, justice, and reconciliation. At the Knowledge Institute, our vision is to lead a strong, evidence-informed quality standard program that supports agencies in delivering the best possible care. From the beginning, our goal has been to create a clear, systematic process for standard development, one that emphasizes engagement, thoughtful implementation, and ongoing evaluation. That very process was piloted in the development of the Levels of Care Quality Standard. The recently released Auditor General's report highlighted gaps and challenges in ensuring timely, equitable, and effective mental health care for children and youth in Ontario. This standard can play a crucial role in addressing these challenges by providing a roadmap for more equitable services that ensure children and youth receive the right level of care at the right time, improving access, consistency, and outcomes across the sector. This standard provides a practical framework for organizing services from least to most intensive based on the unique needs of children and young people. It's designed to help agencies develop, implement, and sustain care models that are both flexible and effective. The standard is built on key principles of individualized care, collaboration and input, accessibility and clarity, and a commitment to continuous improvement. These principles guide every step of the development process and remain central to how we hope the standard will be applied in practice. Importantly, this is a cross-sectoral standard intended to support service delivery across children and youth mental health, child welfare, youth justice, and beyond. By aligning care with actual needs and improving system navigation, the standard aims to enhance outcomes and improve the experiences for care for children, youth, and families. We're not just creating standards, we're building tools that are relevant, usable, and meaningful for the sector. And we look forward to continuing this work together. I will now pass it over to Amy.
Great. Thanks so much, Nicholas. Good morning, everybody. My name is Amy Porath. I use she, her pronouns, and I'm the Director of Research and Knowledge Mobilization here at the Knowledge Institute. During today's webinar, you're going to be hearing from different members of our Quality Standards team here at the Knowledge Institute, as well as members of our Levels of Care Quality Standard Advisory Council. So I have the pleasure of introducing each of our co-presenters for today's webinar. And I ask that as each of our co-presenters introduce themselves, we welcome you to also introduce yourselves in the chat. You can include your name, your preferred pronouns, your role, and if you are comfortable with it, we'd love you to include a fun fact about yourself. So I'm now going to turn it over to our co-presenters, and I'm going to start with Sophia.
Hello, everyone. My name is Sophia Cheltese, and I use the pronouns she, her. And I was a part of the CUSAC from the beginning, and it was an amazing opportunity for me. And I'm also part of the youth advisory at the Knowledge Institute. Now I'll pass it off to Kai.
Hi, my name is Kai. I use he, they pronouns, and I'm also part of KI's Youth Advisory Council. I contribute to this project from an advisory lens.
Great. Thanks so much, Kai. I think next is Andrea.
Good morning, everyone. My name is Andrea Roberts, and I use the pronouns her and she. And I am the CEO of HANDS, the Family Health Network, a children and youth mental health agency in Northeastern Ontario. And I co-chaired the Levels of Care Quality Standard Committee.
Great. Thanks so much, Andrea. Shannon, would you like to introduce yourself?
Thanks so much, Amy. Good morning, everyone. I'm Shannon McGavin. I use she, her pronouns, and I'm the executive director of the Well Community Collective. I was also co-chair with Andrea of this Levels of Care Standard Advisory Council, and I'm a member of the Knowledge Institute's Family Advisory Council.
Great. Thanks so much, Shannon. Louise, would you like to introduce yourself?
Hello, everyone. I'm Louise Marie Learn. I use she, they pronouns, and I bring a family perspective and an engagement perspective to this work as previously part of the CUSAC for the Levels of Care. And a fun fact about me is that it's been 10 years since I first started working with the Knowledge Institute, and I've been grateful for every one of them. Boom.
Thanks so much, Louise. Poppy, would you like to introduce yourself?
Hi, everyone. Good morning. My name is Poppy Day Cloud. I use she, her pronouns, and I'm our manager of research and standards here at the Knowledge Institute.
Great. Thanks, Poppy. And to round us out, Gabby, would you like to introduce yourself?
Absolutely. Hi, my name is Gabby Lucenti, and I use she, her pronouns, and I'm a research coordinator at the Knowledge Institute.
Great. Thanks so much, Gabby. So you've met the co-presenters. I'd also like to acknowledge the many members of our Quality Standard Advisory Committee, as well as other partners who engaged in consultations and shared their expertise with us, which really helped to inform the development of the standard that we'll be presenting on today. So we'll go to the next slide. On the slide here, this really shows how we're going to spend our time together this morning. We're going to be learning a bit more about the Knowledge Institute's approach to developing quality standards. We're going to review what it means, what we mean by quality standards, and what do we mean specifically by levels of care. We're excited to share with you the core principles of this standard, as well as some of its other components, such as the purpose, the scope, as well as promising practices. And we'll be reviewing our knowledge mobilization, implementation, and evaluation resources and supports, which will help to bring the standard to life in the sector. We've also have some space at the end of today's webinar to have a bit of a question and answer period. So we do hope that you will submit some questions. And before I turn it over, just a couple of notes about terminology. And this slide here presents some key terms and definitions that we have used throughout the quality standard. And we all know that using clear and respectful language is important for effective and safer communication. So as you read through the standard, we encourage you to consult the glossary of terms that we developed in collaboration with our advisory committee, as well as our partners. And some of the terms that we feel might be of most benefit for you to pay particular attention to are the definitions we've included on the slide here for caregivers, clients, and equity. And then just a couple of abbreviations. There's so many acronyms that we all encounter every day in our work, but just to familiarize yourself with some of the common ones that we'll be using this morning. LOC refers to levels of care. You'll hear us talking about CUSAC. That's sort of the short form for our Quality Standard Advisory Committee. And SDP refers to our standard development process. So I believe at this point, I'm turning it over to Poppy, who's going to share some information about the format for today's webinar.
Thanks, Amy. So this session is intended for agency staff who will be using the quality standard, although anybody who is here today is welcome and we're so glad you're here. This will be a 45-minute presentation with time for question and answers at the end. If you have questions or comments related to the presentation, please put them in the Q&A box and not the chat box. It's easier for us to make sure we're responding and organizing questions as they're in the Q&A box. The session will be in English. French captioning will be available. Slides will be available in both English and French after the webinar. The session is being recorded and the recording will be available in both English and English captioning or French captioning upon request. If you have questions related to tech difficulties, please use the chat or email our project coordinator, Karen, at the email on the screen. If you have general questions related to standards after the webinar, please send us your questions. We're happy to chat. We have a standards-specific email here, standards@cymha.ca. As with all of our meeting spaces, we are hoping today to create a space that amplifies curiosity and demonstrates openness to different experiences and perspectives. If we don't have time today to answer your question or to speak to a comment, please know that our team is available and happy to connect outside of this webinar. So next is the slide I'm most nervous to present, just because it has very specific steps if you'd like to access French captioning. If you have any more questions about accessing this, please put them in the chat and Karen will help you out. So you can follow the steps illustrated here. Step 1, you'll click on the upward facing arrow next to show captions at the bottom of your Zoom window, and this will launch a captioning options menu. Step 2, at the top of the menu, please enable the translation function using the toggle button. Step 3, in the pop-up window, click on the drop-down menu and select French Canada. Step 4, click Save. Step 5, at the bottom of captioning options menu, select Show Original and Translated Captions. An important note here is that French captioning is auto-generated and may not perfectly translate to what is being said in the moment. The French recording of this webinar and transcription following today's presentation will be reviewed for accuracy. So to get us started, I'm going to review what standards are, as well as the Knowledge Institute's role in and process for creating standards to support high-quality care in the sector. First, we have a quick anonymous survey to get a better sense of your familiarity with quality standards generally, whether you've implemented them and you've read the whole levels of care quality standard or not. So Karen's going to launch the survey now and it should pop up on your screen. I'll give us a minute to submit responses. All right, so we can keep going ahead and you can keep answering the poll questions. We'll take a look at those in a little while. So at the Knowledge Institute, we are developing quality standards to address gaps in the availability of standards specific to our sector, gaps in the availability of standards specific to children and young people. Many standards take a lifespan approach and overlook important nuances within this population. We're also looking to address gaps in meaningful engagement and strong implementation practices to support initial and continued use of quality standards that are developed. Addressing these gaps is important for improving care in children, young people, and caregivers. I'm going to pass it over to Sophia now and then to Andrea to share why standards are important for improving care from a youth and systems perspective.
As a young person, I really understand how overwhelming it can feel to navigate care. This is why standards are essential. They improve access, create clear pathways, and make sure services are accountable for meaningful outcomes. For youth like me, strong standards build trust that the system will actually deliver the support we need. They also bring consistency across communities, ensuring that every young person has the same opportunity to thrive. At their core, standards are not just guidelines. They're a strategy for equity, accountability, and lasting impact.
As most of you know, there are a number of other important projects that are currently in development within the sector, and I think it's important to highlight that the level of care standard is aligned with that other work that's currently taking place. and that includes enhancing integrated care initiatives by building and strengthening community partnerships through Right Time, Right Care. It also includes building seamless pathways to high intensity levels of care in alignment with the Ontario Intensive Treatment Pathway Initiative, creating systems that are designed and serve the special goals and needs of infants and early years, and co-developing models of care with children, young people, and caregivers through engagement initiatives. There has been an intentional effort to enhance the usability and applicability of these standards across the sector by embedding them in the context of other system-level priorities.
So much, Sophia and Andrea. So what do we mean when we talk about quality standard? Quality standards are tools that guide the highest quality care. They are resources that combine the best available evidence to describe what the highest quality looks like. Evidence in this case includes research, lived expertise, and wise practices. Standards support initiatives that are already taking place, but may not be done in the same way, or the optimal way, or consistently. Standards typically consist of several concise but aspirational statements, which are also called principles, and usually standards include examples of best practices and the standard in action, as well as indicators to assess progress. There are important differences between quality standards and clinical or operational standards. Clinical and operational standards describe specific actions that must be taken to meet minimum service provision requirements. Primarily, these standards give detailed specific direction to service providers on how to deliver treatment. Quality standards, what we're talking about today, are comprised of statements grouped by core principles. They describe the highest quality at the systems level and provide an adaptable foundation to understand, strive towards, and advocate for high-quality treatment and care. We developed standards at the Knowledge Institute based on a rigorous 4-phase process that includes scoping, drafting, mobilizing, and maintaining. From the very beginning and all the way through, our process integrates implementation science, knowledge mobilization, evaluation, and meaningful engagement. Our process relies on partnership and collaboration, particularly with our Quality Standard Advisory Committee, or QSAC, which is comprised of a diverse table of partners who share their topic-specific expertise to validate, revise, and approve the quality standard produced by the Knowledge Institute. The QSAC is essential to our standard development. You can see our standard development process here, and we have a brief that describes the process in more detail. If you're interested, you can access it using the QR code on the screen. Our process was developed based on a comprehensive and rigorous review of other standard development processes and was piloted during our development of this Levels of Care standard. The Levels of Care standard, which we are discussing today, is currently in the mobilizing phase, which is focused on disseminating and implementing the standard. When we developed our new standard development process, we sought to embed meaningful engagement practices and an equity lens throughout, to produce standards that are relevant and impactful to all children, young people, and caregivers, as well as service providers and leaders across Ontario. We acknowledge that standardization is a Western-centric approach to improving care, and not all communities wish to be a part of standard development. Standards have and continue to cause harms, particularly through omission of important voices or the prescriptive application of principles that are not relevant or meaningful to communities. We strive to create adaptable, flexible, and non-prescriptive principles-based standards that honor and are inclusive of other approaches and perspectives of health, well-being, and of care, which are accessible and usable for whoever wishes to engage with them. A number of important guidance documents have informed and strengthened our practices to engage young people, caregivers, and community partners, and embed an equity lens throughout our process. These include youth and family engagement quality standards and their core principles to enhance practices that meaningfully connect and intentionally create space for and with young people and caregivers, and a modified health equity impact assessment to help identify and mitigate potential equity impacts and harms of each quality standard. Our processes and practices are continually and iteratively being evaluated, adapted, and improved over time. Through this effort, we created an engagement map, which you can see in this screenshot. The map is a tool we use to outline our methods and activities at every phase of standard development to support the development of inclusive and flexible principles. This includes outlining who we are engaging with and how, as well as delineating feedback loops. Joining us now is Kai to reflect on the importance of engagement and feedback loops.
Standards are only meaningful if they reflect the realities of the people they're meant to serve. Without feedback, there's a real risk of creating policies that appear effective on paper but fail to work in practice. A true feedback loop means more than just a one-time consultation. It's an ongoing cycle of listening, adapting, and reporting back. Young people and families need to see how their input has influenced decisions, otherwise the process can feel tokenistic. By creating these loops, we build trust and accountability. Youth and families feel like partners in the process, not just subjects of it. I've seen how powerful this can be when youth are involved from the start and their feedback is continuously integrated. The standards we produce are more inclusive and sustainable. Ultimately, feedback loops help shift standard development from a top-down model to a collaborative one, where solutions are co-created and better equipped to meet the diverse needs of youth and families.
Thanks so much, Kai. Now we're going to be shifting to the standard itself. So I'll cover what we learned about levels of care and the need for a quality standard. And levels of care does go by other terms, but we use the term levels of care because it aligns with the language and perspectives of those using and delivering services. So levels of care models include different types and intensities of services that are organized from least to most intensive. The most optimal care is matched to clients based on their needs, goals, and preferences. And clients can move through levels as their needs, goals, and preferences change over time. Different types and intensities of care or treatment are also known as a continuum of care, which include everything from low-intensity care, like self-guided resources or brief services, to highly specialized intensive care, like emergency and inpatient psychiatric services. But at all levels of care, children, young people, and caregivers are able to access wellness, health promotion, prevention, and early intervention. Levels of care look different based on the unique needs of clients, and we have a few examples provided by our co-presenters to highlight this. So from a caregiver perspective, Shannon shared that access to strong care coordination, navigation, as a caregiver, moving through levels of care is essential for timely access. From a leadership perspective, Andrea highlighted the importance of creating a complete and interconnected continuum of care that allows young people to move as their needs change over time. And I'm going to now pass it over to Kai and then to Louise to share what levels of care looks like from their perspectives.
The continuum of care looks linear on a slide, but in real life, it often overlaps. From my own experience, I didn't just move neatly from one level to the next. I accessed multiple levels at the same time. For example, I was receiving peer support, which fits under low to moderate intensity care, while also in counseling, moderate intensity care, and at the same time connecting with community-level substance use services, which range from moderate to high intensity depending on the program. Having access to those different supports simultaneously was important because each met a different need. Peer support gave me connection, counseling helped me process and build coping strategies, and substance use services addressed specific health concerns. This experience taught me that the continuum isn't just about moving from less to more intensive care, it's also about integration. Youth often need services at multiple points on the spectrum working together, rather than having to graduate from one before accessing another. That's why building feedback loops and ensuring coordination between services is so critical. Otherwise, young people can fall through the cracks when navigating between levels of care.
So much, Kai. I'll pass it over to Louise.
Which of these images invites you to imagine levels of care journeys like those Shannon, Andrea, and Kai describe? A system guided by this standard has the potential to transform the journeys, experiences, and outcomes of children, young people, and families. Instead of the steep, gap-filled staircase on the left, levels of care looks more like the playground on the right, offering accessibility, flexibility, collaboration, connection, and choice. From a family perspective, a quality standard for levels of care is vital for ensuring that we can get the range of supports we need when we need them and in ways that work for our families across an array of needs, goals, and dimensions of intersectionality, such as being culturally safe, community-based, etc. Back to you, Gabby.
That's wonderful. Thanks, Louise. So when we selected levels of care as the topic for our newest quality standard, we looked at how levels of care are being currently used, the existing gaps and challenges, and how it can be improved through a quality standard. By looking in the literature and through consultations with topic experts, including young people and caregivers with lived and living experiences. So the speech bubbles that you see on this slide highlight just some of the themes that we've heard from young people and caregivers, including the importance of co-development and feedback to center levels of care on the needs and goals of children and young people. We also heard that there are barriers to accessing wellness and low-intensity care resources that are culturally specific, community-based, and youth-centered. And youth and family advisors shared a desire for supports to create levels of care that focus on building trust and supporting clients on their journey through care. They should have the information, skills, and confidence that they can re-enter if they need to. Some youth and caregiver consultations aligned with the larger findings that we heard during scoping. So this included a strong desire for levels of care models that are flexible and specific to the context of communities and that are youth specific. We heard that many agencies are looking to use levels of care models to improve care and advance key provincial priorities in their communities. And we also heard about significant gaps in the consistency and quality of current approaches. So next, we'll be walking through the quality standard at a very high level, focusing on the core principles. So to read the standard in full, you can use the QR code here to find the link to the standard on our webpage. But if you're looking for an easier place to start, you can use the same QR code to access some videos that were produced with some of our lovely co-presenters here today, explaining the core principles of the standard in 4 videos that are 3 minutes or less. So feel free to check those out. So the levels of care quality standard has multiple purposes, but it's intended to ensure that consistent foundational elements are achieved in all levels of care models so that they can be adapted to the local context of communities while still facilitating consistent application, adherence, and optimal outcomes. The standard is intended to help improve the quality of mental health and substance use healthcare for children, young people, and families by strengthening the consistency of approach in the delivery of care, by supporting timely access and clarifying pathways to care. The standard's also intended to have an impact at a systems level by encompassing a continuum of services and collaboration and coordination across sectors, including education, primary care, child welfare, and youth justice. The standard is focused on levels of care models for child and youth mental health, substance use health, and addictions. And when we say child and youth, we refer to an age range of birth to age 25. The standard is intended to support Ontario's community-based child and youth mental health and addictions agencies, which is in line with our mandate at the Knowledge Institute. But the standard really encourages agencies to create partnerships within the sector and across other sectors to bring a high quality levels of care model to life in communities. The standard can also be used by different people. For example, professionals at all levels, leadership and service providers, to develop and implement levels of care models, as well as support children, young people, and caregivers in their understanding of what high quality care looks like and what they can expect when receiving care or co-developing levels of care models with agencies. During drafting, we identified 10 core principles that fit into 4 themes, which you can see summarized here, but we'll be going into more depth shortly. But just as a reminder for core principles as a whole, the core principles describe the practices, processes, and supports that underpin development, implementation, and maintenance of high quality levels of care, meant to be ambitious, but also achievable. They're not a reflection of what is currently happening. And we recognize that every community is in a different place in their journey, and what core principles look like in action varies across communities as well. Finally, all core principles need to be considered together and not just, one at a time. Over the next few slides, Poppy, Sophia, Louise, and I will summarize each core principle individually, but we'll only be highlighting the quality statement or definition of each core principle. And as we're reading through the slides, I'll be flipping through text boxes that will highlight the quality statement, as well as a quote from a young person or caregiver that you can read on your own. But if you would like to see each core principle in full, please have a look at the standard on our website. And with that, I'm going to pass it over to Louise to kick us off.
Thanks, Gabby. The first three core principles are the building blocks or foundation of high quality levels of care. The first core principle is levels of care are client-centered. This means that clients are at the forefront of decision making. Clients' needs, goals, experiences, circumstances, and readiness for care are recognized and respected throughout their levels of care journey. This looks like making care decisions that are evidence-informed and collaborative, centered on the health and well-being needs of clients, and sharing information collaboratively, continually, and over time. The second core principle is levels of care involve caregivers. This means that levels of care support and strengthen the caregiving system by creating space to collaborate with caregivers and valuing and responding to their perspectives and needs in the context of the child or young person's care. This looks like communicating and identifying levels of care collaboratively between service providers and caregivers, and working with children and young people on what caregiver involvement looks like to them, and also supporting caregivers to access care at the same time. The third core principle is levels of care advance equitable care and outcomes. This means levels of care specifically and transparently advance equitable pathways, care, and outcomes for children, young people, and caregivers. This looks like creating levels of care with culturally specific approaches to and perspectives of well-being and built-in partnership with communities that would benefit from accessing levels of care, and embedding specific and actionable considerations to provide equitable pathways and outcomes to care. Over to Sophia.
Oh, sorry, my computer just restarted. I am so sorry about that. But the next three core principles are really focused on how we create levels of care. The fourth core principle is levels of care are co-developed with young people and caregivers. So this means that agencies co-create, monitor, and maintain levels of care with young people and caregivers to really ensure the model is relevant, client-centered, and effective. For me, co-creation means having a voice at the table right from the beginning. It's not about being asked for feedback at the end. It is about being present as a true decision maker. When young people and families are involved in design and planning, the solutions reflect our real needs, values, and experiences. That means the outcomes more relevant, more meaningful, and more likely to create lasting impact.
So much, Louise and Sophia. So the fifth core principle is levels of care are rooted in community and collaboration. This means that agencies create levels of care in partnerships with other agencies and organizations within and across sectors to ensure comprehensive and responsive levels of care. This looks like creating partnerships grounded in collaboration and communication, and creating levels of care that are flexible to the context and build on the existing strengths of communities. The sixth core principle is levels of care are built on a complete and multifaceted continuum of care. This means that levels of care address a full spectrum of needs and goals through a comprehensive continuum of care, including different types and intensities of care. This looks like creating a continuum of care that creates each level using an evidence-based approach. It manages risk, and they improve integrated care initiatives and communities. I'll pass it over to Poppy.
Thanks, Gabby. The next three core principles are focused on moving into, through, out of, and back into levels of care. So the seventh core principle is levels of care are timely and easy to access. This means levels of care are designed with access points and pathways that allow children, young people, and caregivers to easily enter and re-enter levels of care as needed when needed. This looks like creating visible access points to levels of care that are coordinated, designed for specific populations, and can be accessed in a timely manner. The eighth core principle is levels of care are matched to the client's needs and goals. This means children, young people, and caregivers are engaged in a process to align the best care and treatment with their mental health and substance use health and addictions needs and goals. This looks like collaborative processes between service providers and clients, grounded in evidence-based tools and the best judgment of the service provider, and allows clients to match to more than one level of care at a time. The ninth core principle is movement through levels of care is seamless. This means levels of care are designed with pathways that allow clients to move through and out of levels of care seamlessly, adapt to their needs and goals, and maintain progress continuously and over time. This looks like clear, coordinated, and flexible pathways. Clients have access to routine progress and outcome monitoring, matched to the right level of care at the outset, and pathways are built with shared language and smooth transitions. Finally, the 10th and last core principle is levels of care focus on continuous improvement, and it is focused on sustaining levels of care. This means levels of care are designed to continuously adapt and improve over time based on the evolving needs of the community. This looks like evaluating levels of care based on frameworks, data, and emerging evidence, led by skilled staff and shared in a way that brings people and knowledge together. Back to you, Gabby.
Copy. So the standard includes other components for each core principle just to make them applicable and usable to audiences across communities. These components include practical examples to show applicability across different contexts and populations, considerations and suggestions for implementation and measurement to support bringing the core principles to life. It also includes related standards and guiding documents to demonstrate alignment with existing evidence, and the experiences and perspectives of different audiences, which also helps to ground each core principle and the realities and needs of those who will use or will be impacted by the standard. And I'm going to pass it over to Shannon to speak more to the importance of the role that we all play in bringing high quality levels of care to light.
Thanks, Gabby. Just like a growing plant requires a supportive environment and resources from many levels to achieve its greatest potential, so does implementing levels of care. In my role working at the system and community level, I have seen firsthand that high quality care can only be achieved by cooperation, coordination, and collaboration of people at all levels. At the highest level, system leaders and decision makers create and impact the provincial and community environment to initiate, implement, and sustain levels of care models in communities. They supply the resources and policies needed by all other actors to play their part in creating levels of care. Similarly, agency leaders create and impact the environment of the agency by enacting policies that build up a confident and competent workforce. They also play an important role in building partnerships to coordinate care in the community, impacting the quality of care clients receive. Service providers support children, young people, and caregivers to feel heard and connected, address their needs, and progress toward their goals. And all of these efforts culminate to allow clients to flourish because the right levels of care are being matched to their needs and their goals in a way that is collaborative, evidence-based, and identity affirming. And I'll pass it back to Gabby or Poppy.
Thanks, Shannon. Throughout scoping and drafting, we created a really robust quality standard, and we don't want all of that work to sit on a shelf and gather dust. This is where implementation science and evaluation helps to inform our strategy to disseminate and implement the standard during this mobilizing phase. As an intermediary organization, the Knowledge Institute plays an important role in providing the resources and the supports to move plans into action. Intermediaries bridge the gap between what we know and what we do across different contexts and community settings. We support multiple programs and practices within agencies and are responsible for ensuring programs sustain and expand quality over time and across cohorts of staff. Simply put, implementation is the bridge from research to action, or how we link what we know to what we do. I'm going to pass it back to Shannon to share some reflections on the importance of implementation.
Thanks so much, Poppy. Implementation is where the real change happens. A standard on its own is important, but families, youth, and service providers only feel its true impact when it's put into practice in communities. Implementation ensures that evidence-based approaches become consistent, accessible, and sustainable, not dependent on where you live or which agency you connect with. It also builds trust and accountability, showing families and young people that our system is truly committed to more than theory. We're committed to continuous improvement. Practically, this looks different across communities and means we embed equity into everything we do to make sure care reflects the identities and needs of diverse communities. For example, in rural areas, it means creating flexible pathways like schools, community centers, or virtual options to reduce wait times and overcome transportation barriers. Another critical piece is continuous feedback. Implementation isn't a one-time effort. It's about building loops where youth and families share their experiences and services adapt accordingly. One example I often hear from families is when a young person starts with peer support but then needs more targeted therapy. If services are coordinated, families don't face delays or reassessments. Instead, care simply shifts to the right level at the right time. That consistency lowers stress for families, reassures them during crises, and keeps the focus where it belongs, on youth receiving the right care that's adapting as their needs change.
Thanks so much, Shannon. We began thinking about implementation from the very start, well before entering into the formal implementation phase. During scoping of the standard, we used the Consolidated Framework for Implementation Research to identify and assess barriers and facilitators to implementation. We found that challenges to building and sustaining levels of care models included a lack of time, lack of accountability to quality standards, a lack of available health and human resources, uncertainty about where to start with implementation, and competing priorities across the sector. We also heard things that would help, including equity and engagement in any change process, having leadership buy-in, a way to conduct gap assessments, and ensuring there is frequent and effective communication while implementing standards. These insights inform the development of targeted implementation resources and supports. These will help to boost adoption of the quality standards, to sustain ongoing implementation efforts, and to showcase innovations. By integrating implementation science early, we can better influence people's capacity and motivation to drive change, making the process more efficient and more sustainable. All our quality standards implementation resources follow the plan, do, and sustain model of implementation, which you can see here. This model was developed to provide a structure that simplifies implementation into small and actionable steps that make a big impact, like creating a team, defining goals, action planning, and monitoring. It is through resources and supports that are grounded in a strong model of implementation that we bring the quality standard to life. You can see the resources and supports listed in the center here, and Gabby's going to provide a quick overview of them over the next few slides.
So we have a number of implementation resources available on our website now in English and French, and you can see them using the QR code on the screen. So our resources include at the top a guide to implementing the standard, which is meant to help agencies spot what's working, find what needs work, and action improvements in line with the levels of care quality standard. Next, a measurement guide that is general to all standards and provides information for measuring quality standards, including developing a measurement plan and choosing, using, and effectively applying indicators. The third one was an informational two-pager, a quick reference that explains core components of the levels of care standard and how they can support better care for children, young people, and their caregivers. And finally, a service mapping resource, which is a tool that guides agencies to map available services and better understand their existing and ideal continuum of care, including how they connect and overlap and where gaps exist. We are taking an active and intentional approach to our implementation supports. So we're launching different avenues for Knowledge Institute moderated implementation programs to motivate and support agencies implement the quality standard. These supports will provide us an opportunity to evaluate implementation and showcase successful practices that will support the scale and spread of the standard. Include an early adopters program, a coaching program, a standard spotlight program, and a community of practice, which we'll be communicating about over once we start launching our implementation supports. Now I'll pass it over to Andrea.
Thanks so much, Gabby. I just wanted to take a few minutes to talk about the importance of moving this work from theory to practice. The only way that we're going to really improve the system of care across our province is if we have effective and consistent application of the standards. So I would like to ask each of you to consider in your individual agency, what can you do to best integrate these standards into your operational work? Please make use of the excellent user-friendly resources that Gabby just described for you and take advantage of the coaching that's being offered so that we can achieve consistency across the sector. And I'll pass it back to Shannon to highlight how you can play an important role as champions of this standard.
Thanks so much, Andrea. Being a champion means much more than sharing information. It is all about advocacy, amplifying stories, building capacity, promoting equity, and making sure the standard is heard and used at every table where children and youth mental health is being planned and coordinated. Knowledge mobilization really relies on champions to be trustworthy communicators of key messages, reaching different audiences at every level. Champions can act as local advocates, bringing the standard into conversations and places where decisions are being made and where the standard can really shape how services are delivered, like at planning and decision-making tables. Champions can also be story amplifiers. That might look like sharing the voices and experiences coming from youth action councils, family councils, school councils, or other community forums. Champions often act as capacity builders too, helping colleagues and partners understand how the standard fits into their day-to-day work. They can be equity promoters, ensuring diverse youth and family voices are always part of how the standard is applied locally. And as feedback connectors, champions carry questions, challenges, and successes from their communities back to the Knowledge Institute, while also sharing updates and resources back out to their networks. Finally, champions are sustainers, keeping the standard alive in every conversation over time and reminding partners that implementation is not a one-time task, but an ongoing process of learning, adaptation, and improvement. And now pass it back over to Gabby.
Thanks, Shannon. Such a great overview of champions and the importance of their role. So you can play an important role as champions by sharing the standard widely in various communications, prepared to answer questions, and continuing to stay in touch with upcoming implementation resources and activities by subscribing to our newsletter or subscribing to page updates on the Levels of Care webpage. So to request any of our template or FAQ documents or to ask us any questions, please reach out to us using the email address at the bottom of the slide, using the standard specific email address. And I have been advised that our website is currently not working properly right now, but we have our service workers working on it. So you may not be able to access the files right now, but if you keep looking at the website, they will be up shortly. When it comes to standards, evaluation plays a key role in many areas. So one priority for us from the outset was to evaluate how we develop the standard, which is, the process itself. So this is a reminder that the process underpins our whole standard development program. It informs how we develop and implement standards over time. And this is the process that we'll be using repeatedly for all future standards. We have continuously evaluated our process and we've received many recommendations already. And a lot of those recommendations have already been implemented in subsequent phases or have been implemented for our next standard on live-in treatment. Here you can kind of see a summary of our evaluation questions, that we use data collection points, and that we look to the critical improvements that we've made. On the process, we will also be evaluating this standard and standards as a whole on their reach, utility, and impact on the sector. So that will be upcoming as the standard is being implemented. I'll pass it over to Poppy to round us out.
Thanks, Gabby. So now we're looking ahead to our immediate activities to mobilize the Levels of Care standard and our work in other upcoming standards. Very soon, we will be launching some of the activities and resources that have been mentioned throughout this webinar, including agency-specific learning sessions where we can present the standard in a way that's tailored to your agency and your community. If you're interested in this, please reach out to us at the standards email address. We will also be launching the Community of Practice, which is meant to be shaped by you. So we're really hoping that you will share your interest now and expect the first session for the Community of Practice by the end of the year. Karen's going to copy and paste a form into the chat that allows you to express your interest and tell us what you'd like to see in a Community of Practice for this standard. We are currently working on our live-in treatment standard and our family engagement standards in different phases of our process. The live-in treatment quality standard is being drafted right now, and our family engagement standard is actually up for review and so has entered the maintaining phase. Before we move into questions, I just wanted to say a great big thank you to all of our co-panelists with us today, who are not only instrumental in getting this webinar completed, but have been absolutely instrumental in this entire standard development process and the development of this levels of care standard. So thank you so much, everyone, for being here with us today. Now, Amy and I are actually going to move into the Q&A portion here. So I see some folks have been writing some questions into our Q&A. And I know I will be flagged by Karen if anything needs to be moved from the chat into the Q&A function as we're clicking around here. So Amy, I don't know if you can see the Q&A as well, just making sure.
I can, and we've got a couple of really excellent questions. So I don't know, Poppy, did you want me to start, and others can jump in, and then you can maybe monitor for the questions as they come in. But Amy, great name, Amy, has a question about whether these standards will be a ministry implemented standard across different sectors, such as school, live-in treatment, mental health treatment, child protection, etc., similar to the quality service framework for out-of-home placement. So it's a really good question. I think at this point, we are really trying to focus on what supports from an implementation measurement perspective can be needed for different sectors who could be using this standard. We're not aware of any requirements for different agencies or organizations, but instead we're really focusing on how can we best, equip the sector in adopting the standard and bringing it to life in within their organization, within their own community. So I'm not sure, Poppy, if you had anything else you wanted to add.
This point in time, there's nothing that's specifically going to be mandated in terms of like accreditation with this standard, but we definitely took that into account during our implementation needs assessment. And so we're rolling out as much programming as possible to kind of incentivize the adoption of these standards and make it easy for agencies to set goals that are in line with the standards, as well as some of the other accreditation work that they do. So that's all been rolled into the programming that we're offering and a lot of the resources that we provide. I'll maybe move on to Amy's next question, and totally fine that you have a lot of questions. That's great. Is there someone who would be coordinating these services for the family? Is coordinated service planning rolled into this? And yes, coordinated service planning is rolled in to the standard more so as practical examples, just acknowledging that access to coordinated service planning and the use of coordinated service planning can be quite different region to region and community to community, but it is a consideration that's embedded into the standard, and you can see it highlighted in promising practices and practical examples. And Gabby, I don't know if there was anything to add to that. I see you nodding, all right? All right, we will see if any more questions pop up as we're working through this. I see that we have a couple minutes left, and we know there was maybe a couple of things that we could anticipate folks being curious about. So one thing that we did want to highlight, just if we had some time, was who was involved in developing this quality standard, just because it is important to highlight all of the folks that were involved in making sure this standard turned into what it is today. So it was developed in consultation with many partners and experts, and we did mention, but now I can highlight our Quality Standard Advisory Committee, which for levels of care was comprised of 21 topic experts. And this included young people, caregivers, scientists, service providers, senior leaders, and decision makers from all across the province. Young people and caregivers participated in the advisory committee, but also in different mechanisms and feedback sessions, and helped us with revisions and input throughout standard development. And these were young people and caregivers across Ontario. Staff from agencies that serve specific communities, including Indigenous, Black, 2S, LGBTQIA+ communities, newcomers, and Francophone communities, all engaged with us throughout standard development, and staff from agencies in other sectors that play an important role that you've heard us allude to many times throughout this presentation, who connect with child and youth mental health and substance use health and addiction system, including things like education and health. So I saw another question pop up here. How will staff be supported to receive training on the standard? Often training doesn't trickle down to frontline. It's very important that this does. So that's a really great question. And my initial thought is just that slide that Gabby just shared, where we'd encourage you to contact us if you're interested in an agency-specific training. What we're trying to deliver over our mobilizing phase are targeted trainings that would address the specific needs of different communities and agencies, and hopefully create training models that could trickle down or be sustained over time. And so there's no kind of cookie cutter answer for me to give here, except we would love to work with you to figure out what the specific needs are for your agency so that we can deliver learning sessions, whether it's a one-time or it's a few learning sessions, in order to meet the needs of your agency. I don't know, Amy, if you have anything else to add.
I think the only other thing I would add, Poppy, is that in all of our work, we work very closely with members of the Child and Youth Mental Health Lead Agency Consortium. And I know they're very well versed in this new levels of care standard. We've been keeping them updated as we move along. And so part of that partnership with them is being able to sort of share what we're hearing through the QSAC, through other consultations, through this webinar today about the importance of having these training opportunities. And I know we have at least a couple of members from the Lead Agency Consortium on the webinar today. So it's a really great point. And I think, we can ensure that point gets shared back with members of the Lead Agency Consortium. And as Poppy said, there's a lot of different opportunities that the team has really designed and based upon what we heard as we were holding the consultations to develop this standard.
Thanks, Amy. And I love this question, which will probably be one of our last. Is this standard to be implemented via an assessment tool? If so, what is that tool? Just gives me the opportunity to highlight something that we couldn't really get into in the webinar. There is no assessment tool. A big priority for us is flexibility, so that different communities across Ontario feel that they can dive into this standard wherever they're at. There is, however, a measurement guide that accompanies our implementation resources, and there is an indicator workbook. So we have developed indicators specific to each of the core principles in the standard, and we've developed a comprehensive indicator workbook that will support folks in developing their individualized measurement plans for the standard. This is embedded into the implementation resources. This workbook is provided on request, and so it's not listed in our resource hub or on the website, although it's mentioned throughout the resources. All you have to do is send us an email and we will send out the indicator workbook to you. We did this knowing that there's probably extra supports needed around the use of the indicator workbook, and so we wanted to make sure that we were directly attached to any requests for it in order to answer questions and work with agencies that wanted to start to use it. Great. And we are at time. And so thank you so much for submitting those great questions. And as I mentioned earlier, we are available if you wanted to have any follow-up conversations. I wanted to thank you all for being here today. And thanks again to all of our co-panelists. Enjoy the rest of your day.